prosthetic options in implant dentistry. So, in completely edentulous patients, a removable implant prosthesis, it is often the treatment plan because of its low cost as well as several advantages over fixed prosthesis. So, what are the advantages of fixed prosthesis? The first and most important advantage is it is very psychological. That is, it will feel more like a natural teeth. Then it requires less food entrapment as well as it requires only very less maintenance. And then there is longevity as well as similar lab charges as complete implant supported overdentures. Next is the prosthodontic classification. In prosthodontic classification, it was given in 1989 by Mish and he proposed 5 prosthodontic options in which the first 3 options are fixed, which is FP1, FP2 and FP3, and the final 2 are partially removable partial dentition. That is, they will replace partial or the total dentition and it may be cemented or screw retained. And the other 2 types are the removable prostheses, that is RP4 and RP5, and they depend on the amount of implant support and not on the appearance of the prosthesis. So, in this 5 classification, the first 3 are fixed, that is FP1, FP2 and FP3, and the last 2 are RP4 and RP5, which is a removable prosthesis and it depends on the number of implants that is present. The first one is FP1. FP1 means it is a fixed prosthesis which will replace only the crown and it will look more like a natural tooth. And in case of FP2 prosthesis means it is replacing the crown as well as a portion of the root and the crown contour will appear normal and in the occlusal half, but it is elongated or it is having a hyper contoured appearance in the gingival half. That is, in FP1 it is replacing only the crown of the tooth, whereas in FP2 it will replace the crown as well as the small portion of gingiva. So, it will appear, the tooth will appear as elongated. So, FP1 it will appear as normal tooth, whereas in FP2 it will have an elongated appearance. Next one is FP3. In FP3 prosthesis, it is replacing the missing crown and the gingival color and the portion of the edentulous site. So, this prosthesis most often uses denture teeth and acrylic gingiva, but may be porcelain to metal. That is, in this it is replacing the tooth as well as the portion of the gingiva. So, it uses gingival color or the gingival acrylic. So, mainly it uses acrylic tooth for replacing FP3 type of prosthesis. Next is RP4. RP4 means it is a removable prosthesis and it is an overdenture which is completely supported by implants. Whereas RP5 means it is an overdenture which is supported both by implants as well as soft tissues. So, this is RP4 and RP5. In RP4, it is completely supported only by the implants. That is, it requires 4 or 5 implants and it is completely implant supported. Whereas in RP5, it requires only 2 implants and it is implant as well as soft tissue supported. Next is FP1 restoration. In FP1, it replaces only the anatomical portion of the missing natural teeth and usually there is loss of hard and soft tissues is minimal in case of FP1 restoration and the volume and the position of the residual bone. It will permit the ideal placement of the implant in the location which is similar to the root which was occupied by natural teeth. This is the FP1 which is replacing only the natural tooth. So, the final restoration, it will appear similar in size and contour of the traditional fixed prosthesis and it is used to restore or replace the natural crown or the teeth. Desired, often it replaces the maxillary anterior teeth. So, FP1 restorations are usually used to restore the maxillary anterior teeth. And in FP1 prosthesis, they are difficult to achieve when more than 2 teeth is missing. And the bone loss and the lack of interdental soft tissue will complicate the final aesthetic result, especially in the cervical region of the crown. And the restoration material of choice is porcelain to noble metal alloys. But in this case, the noble metal alloys, it is difficult. So, noble metal alloy substrate can easily be separated and soldered if necessary. There is less chance of corrosion in case of noble metal alloys.
Download Blulines now, redefining quality education.